Hi everyone, Dr. Vipul Shah here, Clinical Director at TELEHEALTH, here for our weekly COVID-19 update. Still filming from my house because we're still on those stay-at-home orders, but it looks like some of those socially distancing measures as well as the stay-at-home orders are making a difference, as we have noticed a drop in new cases in some of the hot spots. So great work everyone, and I know this is hard, but it's making a difference, and we're really making a huge difference to people who are most vulnerable amongst us. So keep it up and keep doing the things that you can do to stay safe, and washing your hands and staying 6 feet apart from people. These are all very important and are making a big difference. So today's topic is going to be telehealth, and luckily I happen to live with a family medicine doctor who is currently practicing telehealth, and so my wife, Dr. Brandy Shah, is going to be joining us here in just a minute and talking about her experiences with telehealth and giving us some advice on how to best use telehealth. So Dr. Shah, thank you so much for being with us today.
It's nice to be with you, Dr. Shah.
So can you tell us a little bit about what your experience with telehealth has been and what you do?
So I am a family medicine physician, and I've been practicing family medicine for roughly the past 8 years. And so most of my experience with medicine has been traditional medicine. However, with my current practice, I've been spearheading the development of our telemedicine program given the current circumstances with COVID. So I've learned quite a bit about telemedicine and how to implement it.
So with COVID-19, what have you noticed are the major changes with telehealth?
From what I've learned from understanding the policies that regulated telemedicine and telehealth in the past, the major changes are the fact that now telemedicine is virtually open to sort of all practitioners and all patients, when previously there were significant restrictions on who could practice telemedicine and which patient could receive it. That's the biggest change. I would say beyond that, there have been other critical changes to our practice that make it more logistically possible to practice telemedicine. For instance, some guidance that came out over the last month from the Center for Medicare Services is that now we can do telemedicine with previously unacceptable ways of getting information from patients. So using things like FaceTime, Zoom, Skype, these are things that we use in our everyday lives to have interactions with people. They're not encrypted and they don't necessarily protect our medical information, so they haven't been able to be used up until this point. However, again, because of the current circumstances, the government has opened up the ability to be able to use even platforms like Skype and Zoom in order to be able to conduct these visits.
So is it safe to use those platforms, given that you said they're not encrypted?
It is safe to use them because providers and practices are going to great lengths to still protect medical information as much as possible. And it's worth asking your provider what they're doing to make sure that they're still protecting your medical information, even though some of these policies and procedures have been liberated. So in our personal practice that we do in my clinic, I still let people know that I'm in a private space when I'm conducting a visit, that we won't be interrupted, just like it would be in a normal exam room. So that even that first layer of protection means that not just anyone walking around is going to be able to know your medical information. However, these platforms aren't encrypted, and so there is the possibility that information could get leaked on the internet. But in the current circumstances, it means that in some cases, unless your practice is using an encrypted platform, that this may be necessary. However, I think that one thing that's becoming clear is that telemedicine is going to be something that's going to be here to stay. And it's my guess that most practices will find and use more of the encrypted and safe platforms as that becomes more of the case.
And for patients who do use this now, do they have to pay more for telehealth than a normal visit, or is it less? What does the payment look like for people?
So payment is the same. That's one of the things that has stayed the same regardless of the government changes that have been recently communicated to us as providers. If you had to pay a copay for your visit previously when you went and walked into the provider's office, you'll still have to pay a copay just like you would previously, and any other out-of-pocket costs that might go along with your care, such as lab costs, prescription costs, deductibles, any of those costs that tend to add up sometimes, especially at the beginning of the year, those will still apply. Just the fact that it's telemedicine doesn't change that.
Is there any reason that you couldn't use telemedicine? Are there conditions that you've encountered that really you have to go in person, or are there any recommendations that you would have as a provider that you say you really need to come to the doctor's office specifically?
So there are some situations where using telemedicine wouldn't be the safest option. So you can think about cases like when someone has acute chest pain. These are situations where we ask a lot of important questions, and if there are concerning answers to those questions, then we will typically refer someone to the emergency department to have a workup that will hopefully rule out any sort of cardiac disease. So you can think about something like acute chest pain being an issue, some cases of acute abdominal pain where we might be worried about an organ that needs surgery would be another case that may not be applicable for telemedicine. Those would be the top two things that I would think about. For the most part, one thing that is reassuring about telemedicine is that it can actually be really helpful for a provider to just see you on the camera in order to triage you, to know how to guide you to go about making your medical decisions. So even though I wouldn't be able to treat acute chest pain over a telemedicine visit, I could see someone and see how sick they look, get an understanding of what their needs are, and refer them to the emergency department and maybe coordinate some of that care. So telemedicine can be a useful triage tool so that we make sure that we direct you to the right place.
So speaking of triage tools, I know a lot of people are concerned about symptoms of COVID-19 and coronavirus. So is telemedicine a good way to get screened for COVID-19?
It's a great way to screen for COVID-19, especially if you're not having any significantly concerning symptoms. So if you're acutely short of breath, you have that acute chest pain that I was just talking about, you have an exceptionally high fever, then your best bet is going to be to go to the nearest emergency department. But for the majority of people who are being affected by COVID-19, most cases are mild to moderate. And so those are situations where we can assess your symptoms over a video visit and get a good sense of whether or not we need to automatically have you come into the clinic to be seen or go to the emergency department to be evaluated, or whether we can just give you treatment advice over the video visit and have you take care of yourself on your own at home.
That's super helpful. I think that's a big part of what we're trying to say, is that that's a good way to not have to go to the emergency room or go to see your provider right now.
Definitely.
In terms of, a lot of our members have chronic conditions that they're dealing with, and they normally would be seeing their providers. Is telemedicine something that they can use in order for maintenance visits? What if they've never seen a specialist? How does that work?
So telemedicine is great for managing chronic diseases. Because especially in cases where your provider already knows you and already has a baseline understanding of you, seeing you on video isn't going to be that much different. Of course, there could be some limitations to being able to do physical exam that might be important for monitoring a chronic disease, but we can usually find ways around that. Again, especially if we know your baseline. It can be helpful if you have tools at home that can help to guide us. So if, for example, you have high blood pressure or hypertension, if you have a home blood pressure cuff, it could be really helpful to use that to take your blood pressure at home and record the values so that your provider can go over that information with you at the visit, the video visit that you have with them. Other conditions like diabetes, having your glucometer on hand and doing your home blood sugar readings can also be very helpful. If you have a trusted family member or other person in your life who's in the home with you, they can sometimes help with doing some of the non-private physical exam things that might need to be done, such as checking to see if you have swelling in your legs, if you have a condition like congestive heart failure. So there are ways that we can get around the physical exam portion in order to get really useful information and still be able to provide you the same standard of care that you're used to.
I think that's a great idea in terms of using your people in your house to help you with your physical exam. What about if you need a prescription? Can telehealth help? Can you prescribe prescriptions?
Yes, we can definitely still prescribe medicine. I know for our practice, we use a certain platform to do the video visit, but then we still have our electronic medical record available to us to still do the basic functions that we normally do, like electronically prescribe. So it's still very easy for me, for the majority of medications, to put an order into the computer and send it to your preferred pharmacy. There are going to be some medications, controlled substances like narcotic drugs, stimulant medications, that are going to be a bit harder to transmit to a pharmacy unless you have certain capabilities in your telemedicine platform. Right now, though, the government has also released some guidance related to that is making it more possible to be able to prescribe those things, especially emergency supplies of those medications. However, it's not clear how long that guidance and those policies will be in place. So we'll certainly have to develop more sustainable solutions for those issues. But for the most part, your average medications that you need refilled and prescribed can still be done through the usual practices.
What if your provider doesn't offer telemedicine? Are you able to go to a new provider if you've never seen one before?
So yes, you can definitely go to see a new provider. It would be a matter of figuring out which clinics and practices and providers are taking new patients for telemedicine visits. Practices like mine are doing so. Some of the issues that you need to think about related to that is making sure that you're in the same state as the provider that you want to see, because there are restrictions on us as providers in terms of being able to provide care under our medical licenses in the same state as a patient. So that's one consideration. The other thing would be asking some of those questions now that you have the opportunity that we talked about before. So getting an understanding of what telemedicine platform the provider is using. Is it encrypted? Is it safe? What kind of functionality does it offer? What kind of follow-up processes are in place? Just to make sure that you understand what a visit will be like and making sure that it meets your needs. Other than that, another thing to keep in mind is that even if a provider doesn't have access to video visits, which is what we've been talking about mostly here, providers are able to conduct phone visits as well. So it may not be ideal because it helps to see you on the screen, but your providers can follow up with you via phone and still get a lot of information as well. So even in the meantime, if you're at a practice that doesn't have video visits, you can ask if you can conduct a visit over the phone.
So what do you think is the best way for patients to really make use of telehealth, or what can they do to make their visits the most useful?
The biggest thing I would say is thinking about any of those tools that you have around you that can help to give your provider information about your condition and about your status. So a home blood pressure monitor, a home blood glucose reader, even things like your Apple Watch or a Fitbit that can tell your heart rate or oxygen saturation can be really helpful. Even more simply, a thermometer. So if you are calling or want to have a visit because of COVID-19 symptoms, one of the best sources of information we can get is a temperature reading from a thermometer. So just being mindful of the tools that you already have available that can be helpful for the visit. Asking questions if you don't understand how the telemedicine visit is going to work, just because there's a delay there in terms of like how you get information and then how the visit happens. And so you might be doing a lot of portal messaging or emailing ahead of time, and so it's asynchronous, and so there's a lot of information that you may not have on hand at the time. So clearing up any issues before you actually get to the visit point can be really helpful. That includes clearing up any issues you might have with technology and technical difficulties. So if you're not able to download an app, or you don't have a phone that accepts text messages, or for some other reason you can't use the platform that your provider is offering, then don't be shy about letting your provider know that, because many of us do have workarounds for being able to provide you care even if you're not able to use the plan A. We do have plan Bs and plan Cs.
Great. Thank you so much for being here with us and being in the house with me. And so
Thank you for having me.
And we appreciate your time. So once again, thank you so much to Dr. Brandy Shaw for being on this update with us and giving all her expertise on telehealth. Once again, if you need anything, please reach out to your health advisor, whether that's help with groceries or help with medications or any other questions about telehealth. We do have some new resources on PACHealth that are going to be addressing telehealth questions, and we will continue to answer questions as best as we can as they come up. So once again, have a great week, stay safe, and we'll see you next week.